Welcome to Q&A with CNA. My name is Chelsea Shar. I'll be your host today, and I'm here with two guests. Today on our program, we have Prevention Program Manager Ashlie Lamp and Marissa Cooney. So let's start with your introductions. So Ashlie, welcome back to the show. You've been on before. It's great to have you back again. And since you were recently here and you gave us your background, why don't you just start with an interesting fact about yourself, a hobby or something for our viewers to know about you?
Yeah, thank you for having us.
Yeah.
So I am a child and adolescent, the prevention program manager. So something interesting about myself is I do have 4 daughters, and they range in age from 6 to 18.
Oh, wow. So there's a lot of girl power in your
There
house
is a lot of girl power, my poor husband. But what takes up majority of our time is softball. All of my girls play. So my husband and I spend a lot of time coaching multiple teams all at once.
Fun.
So it's pretty busy.
Awesome. And just the taxi job alone of taking everyone to all their things.
Yeah.
I can only imagine.
It's fun though.
Awesome. Well, thank you for being here. And Marissa, we're always glad to welcome you back. Can you talk to us about the prevention, as a prevention team supervisor, maybe if they missed your last visit, how you came into that job, your background, kind of coming into that role?
Yeah, so I am Stark County, born and raised. That is where I went to school for my undergrad in social work at Malone University, and then I continued on at Case Western to get my graduate degree also in social work. And I actually started at CNA with an undergrad internship, continued my graduate school internship there, and have kind of just existed with them ever since, starting boots on the ground in the prevention program. Awesome. And then, slowly but surely moving up to a supervisor role.
Great. That's awesome. So today we're going to be talking about the Stark County Youth-Led Prevention Program specifically. And Ashlie, looking at the website, we see that prevention covers several different areas. Can you start by giving us an overview of the prevention program as a whole and what that is?
Yeah, so that's kind of a loaded question because our prevention program covers so many different populations. We work with children birth all the way through adulthood, including Stark County Youth-Led Prevention for our teenagers. We provide services in child care centers, elementary schools, middle schools, high schools, and also work with adults in building adult resiliency and providing P, which is positive parenting program.
Wow, okay.
So that parents can also prevent some of those issues that they might be having in the homes.
Right, great, okay. And one part of that work focuses on infant and early childhood program, as you mentioned. Can you tell us a little bit more about that and who that serves? Yeah,
so that program is really geared at like birth to 6 years old. We have consultants that go into child care centers and work with children and staff and help build the social emotional skills for those children and teach the early childhood teachers how to manage behaviors, how to facilitate the growth of social emotional skills, and just working all around prevention strategies to help prevent child abuse, neglect, social emotional challenges. And then also working with the adults in those centers and the parents to build adult wellness and resiliency. So really just working across the board to build resiliency in our kids and families and teachers.
There's a huge need for that, I'm sure.
Yes.
So, Marissa, in past visits, you've discussed the Stark County Youth-Led Prevention Program, which also recently we heard about from Maria. So can you explain a little bit about the behavioral health component of the prevention program and how that fits into the larger picture here?
Yeah, so the BH prevention program, or behavioral health, is the one that I mostly oversee here at CNA. So that is our elementary through high school curriculum programming. And so we run a couple of different curriculums with the funding from Stark-Mar, which is amazing, that we can go into different school buildings. We can connect with school staff, typically admin, school counselors, individuals like that. They help identify students who might be at heightened risk for social emotional concerns or for mental health concerns. And so We do small pull-out groups, typically during like lunch times or during specials times, things like that, where they get an opportunity once a week to just come in with a group of peers and have conversations to boost, again, those social emotional skills, such as self-esteem, decision-making skills, peer pressure skills, just boosting their confidence in their ability to recognize their skills, but to also recognize the supports that are available to them so that they, if they ever do face life ick, if things ever do kind of come at them socially, emotionally, or mental health wise, they kind of already have those skills built in and they already know the types of things they might be able to do to move forward in positive ways.
Great, that's awesome. So Ashlie, since 2021, CNA has also been involved in after-school programming, like at the YMCA here in Alliance. Can you tell us what types of activities or lessons they do in those after-school environments?
Yeah, so they do lots of things. We have prevention providers go into those settings and they're working with the children and the staff. They provide de-escalation, skills for improving social emotional development, working on building resiliency with those children, teaching them conflict resolution, and then also really working with the staff and teaching them strategies for managing things on their own, because we really do want to build the relationship between the children attending those programs and the staff that are actually in the classroom and spending so much time with those children.
That's great. And staff often don't get training on that specific, it's kind of like a secondary trauma of dealing with a student who has all of that trauma and knowing how to do that. So that's a really great resource. Do you have any data or feedback showing how effective these prevention programs are in that after-school setting? Yeah,
so we collect data on all of our programs because we're constantly just trying to evaluate things and make sure what we're doing is making a difference. Specifically for those programs, over the years we've shown consistently that 90+% of those children are showing improved relationships with their adults that are in those settings and also adults in the homes, and then 90+% are also showing growth and development of social emotional skills and use of healthy coping skills.
Yeah, that's awesome. And I'm sure there's a lot of data you can't even trace because the ripple would be so large, you know, with once they get into high school not having expulsion or suspension rates because of things they got conflict resolution as an elementary school student. So that's awesome.
Right, and that's also another piece of the data that we collect as far as suspensions and expulsions from programs. And we consistently show that one or less students are being expelled from those programs.
That's huge. And I know that like from school districts, that's a huge initiative. They're always wanting to decrease that, but then it's how, you know, do you do that? So a program like yours is a great answer. So Marissa, your team also works with middle school students on prevention strategies related to drug and alcohol use. How effective has that program been?
Yeah, so we also collect data for all of our BH programs. And so one of the key pieces does have to do with substance use prevention. And much like in our after-school programs, the majority of our young people, especially in our middle schools, are reporting after, you know, being through our programs that they're not using substances while still being well aware of them in their communities. So I think that says a lot about the connections that they're making in the program, because our programs are mostly focused on building those social emotional skills so that instead of turning towards substance use at an early age, they choose instead other healthier coping skills for themselves. So it kind of puzzle pieces itself together.
Right, great. So Marissa, working in prevention must be incredibly meaningful, and how is it rewarding to you personally? Like, what are some things that you gain out of that experience?
Yeah, so I get the pleasure of overseeing all of our direct service staff who are running these programs. And so whenever I get to talk to them in supervision or in meetings, they get to recount a lot of the really positive relationships that they're making, which is just really awesome to hear and see. It has helped us to be able to expand into different districts, expand into different buildings, which is very rewarding to see our efforts grow. And so, yeah, there's just a lot that we get to share with the communities that we're in. We get to go to like their open houses, which is really awesome. We get to build that relationship with those families from the beginning. So there's just a lot of really rewarding aspects to the job.
That's amazing. So Ashlie, before we wrap up, is there anything else you'd like to add?
Yeah, so this is a new role for me, but I also came from this background. It was one of the first things that I did when I came into CNA. So I'm super excited to work with this team. We have a great team, including Marissa and our other supervisor and just all the girls that are providing the direct work. So I'm super excited to see where things go. And then also excited to see what other grant opportunities we find, because we're constantly looking for ways to expand our prevention services and extend our outreach.
Great, awesome. And good luck to both of you. Thank you for all the service that you offer our community. I know that here at Alliance we take advantage of that in a lot of different aspects, and as we talked about off camera, that we hope that expands in the future even more. So thank you both for coming today.
Thank you.
And thank you for watching. This has been Q&A with CNA.